Welcome to the fascinating world of brain injuries and the body's incredible response to them. When it comes to mild traumatic brain injuries, sometimes called concussions or more severe traumatic brain injuries, our bodies spring into action with a complex neuroinflammatory response. Think of it as your immune system throwing a tiny party in your brain to heal the damage. This response involves all sorts of players: cytokines like tumor necrosis factor alpha, interleukin 1, interleukin 6, and interferon alpha. Each doing their part, these pro-inflammatory messengers help coordinate the immune cells that rush to the scene, aiming to repair and defend. But sometimes this party goes a little too lively, leading to chronic inflammation that can cause lingering post-concussive symptoms like headaches, fatigue, sleep disturbances, and difficulty concentrating. Now, these cytokines don't just stay in the brain, they can spill over into the bloodstream, where markers like C-reactive protein signaling that inflammation is running high. This systematic injury can influence not just physical health, but also emotional well-being. It's no wonder that after a traumatic brain injury, many folks experience psychological symptoms such as depression, anxiety, or even post-traumatic stress disorder. These emotional changes can sometimes feel as overwhelming as the physical symptoms. And the story doesn't end there. The immune response can sometimes trigger or exacerbate neurological and psychiatric conditions like schizophrenia, bipolar disorder, multiple sclerosis, or seizure disorders. Even central nervous system infections like meningitis or encephalitis can be part of this intricate puzzle, where the immune system's effort to fight off pathogens mingle with injury responses. Within this biological dance, growth factors like epidermal growth factor, fibroblast growth factor, vascular endothelial growth factor act as the body's repair signals, promoting health and regeneration. Meanwhile, chemokines and macrophage-derived chemoattractants guide immune cells to the injured site, orchestrating a delicate balance between repair and inflammation. Chronic inflammation resulting from these processes can impact quality of life, leading to ongoing symptoms and emotional challenges. It's a reminder of how interconnected our physical and mental health truly are, especially in the aftermath of brain injuries, from mild concussions to complex neurological disorders like multiple sclerosis or seizure disorders. Understanding this immune response helps us better support recovery and well-being. While the cellular chaos impacts neuronal functions like axonal transport, sprouting, and synaptogenesis, the formation of new connections. When neurons are damaged, it affects the axons, long projections that signal and can cause axonal bulbs and damage the entire network of nerve cells. This leads to impaired synaptic plasticity. Meanwhile, the brain's ability to adapt and learn is compromised. So whether it's from a concussion, repeated hits, or other head injuries, the cascade of events involving immune responses, protein misfolding, and cellular damage can lead to lasting neurological dysfunction, mood changes, and even behavior disorders. Scientists are exploring various strategies, including secretase inhibitors and other therapies to halt or slow down this process.